name's Liza. I'm going to be your student nurse today. Can I get your name and date of birth?
Macy Brazel, September 29th, 2004.
Okay, awesome. And do you know where you are?
Clearwater Hall.
Okay, why are you here today?
For a cardiac assessment.
Alright, and what time is it approximately?
5-ish.
5-ish, okay. Yes, you're here for a cardiac assessment. I'm just going to check your well-being and see how you're doing. Are you experiencing any dizziness or lightheadedness?
No.
Any shortness of breath or chest pain?
Nope.
Okay. Do you have any history of heart attack, heart issues, blood pressure issues?
Nope.
Okay. And then do you currently take any medications related to any heart issues?
No.
No. Okay, awesome. Then we're just going to get started. I'm going to start by taking radial pulse. Radial pulse is equal and strong. Sorry, I'm going to do your cap refill, which is less than 3 seconds. And would you squeeze my hand? Okay, awesome. CMS is intact. And then my patient is also alert and oriented ×4 and makes eye contact and has a calm affect. All right, we're going to go ahead and we're going to get started with some lung sounds. Can I have you take your shirt off? Okay, and if you would just take a nice big deep breath in every time I move my stethoscope, that would be fabulous. Okay. Good. And then if you go ahead and rotate, I'll do your back. Oh, sorry. Okay. Okay, awesome. Your respiratory, your lungs sound great, and your respiratory rate sounds regular. I'm going to now listen to your heart. I don't think put this away quite yet. Okay, so with your heart, every time I move my stethoscope, I'm going to start with the light hand and then press down a little bit so I can hear some different heart tones. Also going to listen for your apical pulse right here. The apical pulse is about an 87. And the heart sounds are, the rhythm is regular, and there is no presence of any abnormal heart sounds. All right, if I could have you now lay back, please. I'm going to observe your abdomen. The abdomen appears to be flat. That's good. Okay, I'm going to start by listening to your vowel tones. Okay, there's presence of bowel tones in all the 4 quadrants. I'm now going to palpate. If you let me know if you feel any tenderness, please. Any of that hurt? Okay, wonderful. You can go ahead and button your pants back up. I'm going to move down to your legs. Okay, I'm going to check for edema of any sort, tenderness. There's no edema. Does any of that hurt?
Nope.
Okay, and then if you go ahead and lift up your legs and slide them back down. Okay, and does any of that hurt?
Nope.
No. Okay, and move yourself really fast. Okay, check for pedal pulse. Pedal pulse is strong and equal if you pull up on the hands, if you push down. Okay, and cap refill is less than 3 seconds. Alright, and then the skin is warm, dry, and pink. And then lastly, since I don't have a bed that I can raise for cardiac assessment, I would raise the head of the bed to 45-degree angle, remove the patient's pillow, and then have them turn their head away from me and observe for any distension of the jugular vein. That's it.